Welcome to Trinity Med TV. In today's episode of Medical Tips, we shall be discussing about a topic called the process of pregnancy. This we shall be presenting a series on the process of pregnancy. This video serves as a reference materials for medical students, nurses, community health and public health practitioners, and the expectant mothers. Please stay tuned. And to all expectant mothers, I hope this video will be a helpful companion for you throughout your journey of your pregnancy. Now let's begin. A healthy first trimester is crucial to the normal development of the fetus. You may not be showing much on the outside yet, but on the inside, all of the major body organs and systems of the fetus are forming. As the embryo implants itself into the uterine wall, several developments take place. Pregnancy begins when a man's sperm fertilizes a woman's egg in one of the fallopian tubes to form a zygote. Then, the zygote travels down the fallopian tube where it becomes a morula. From morula to blastocyst, the blastocyst then burrows into the uterine wall, which is called implantation. Since women don't always know when fertilization occurs, doctors or health workers calculate pregnancy based on the first day of your last menstrual period. You might have been fertilized just 2 weeks ago, but because your last period was 4 weeks ago, you are officially 4 weeks pregnant, and at that time of your missed period, the doctors or midwives will count 40 weeks forward in order to estimate your expected due date, while ultrasound scan can also be used. I will talk briefly about changes that happens to the body at first trimester before continuing with further development. Women experience these changes differently. The mammary gland enlarges, causing the breast to swell and become tender in preparation for breastfeeding. This is due to an increased amount of the hormones estrogen and progesterone. 2. The areolas, that is, the pigmented areas around each breast nipples wall, enlarge and darken. They may become covered with small white bumps called Montgomery's tubercles. 3. Veins become more noticeable on the surface of the breast. 4. The uterus is growing and begins to press on the bladder, which causes you to urinate more often. You might also experience mood swings similar to premenstrual syndrome. Another symptom that you can notice during pregnancy is increased levels of hormones to sustain the pregnancy may cause morning sickness, which causes nausea and sometimes vomiting. Constipation may happen as the growing uterus presses on the rectum and the intestines. Due to high level of progesterone, the muscular contractions in the intestine, which help to move food through the digestive tract, are slowed down, which might cause heartburn, indigestion, and constipation. You may also experience extreme tiredness due to physical and emotional demands of pregnancy. Cardiac volume increases by about 40 to 50% from the beginning to the end of pregnancy. Most pregnant women gain between 10 to 12.5 kg and put on most of the weight after week 20. Most of the extra weight is due to the growing fetus, but your body will also store fat to turn into breast milk when your baby is born. In the first month of the pregnancy, a thin walled sac forms around the embryo. The sac is filled with liquid which protects the embryo from injury and also regulate the temperature of the embryo. This sac is known as the amniotic sac. There is another type of sac called the yolk sac. This sac provides nutrients to the embryo while the placenta is developing. The fetal nervous system, which is the fourth system to develop at about the end of week 4 of pregnancy. The neural plate folds upon itself to form the neural tube, which will later differentiate into the spinal cord and the brain, and eventually forming the central nervous system. In the same week, the pulmonary structure that becomes the fetus heart begins spontaneously pulsing. Blood cells will take shape and circulation will begin. The embryo looks like a tadpole. The eyes and ears are developing. Tiny lip spores appear, which will develop into arms and legs. By the end of the 8 weeks, all major body systems continue to develop and function, including the circulatory, nervous, digestive, and urinary systems. The embryo is taking on a human shape, although the head is larger in proportion to the rest of the body. The mouth is developing tooth buds, which will become baby teeth. The eyes, nose, mouth, and ears are becoming more distinct. The arms and legs can be easily seen. The fingers and toes are still webbed, but can be clearly distinguished. The bones begin to develop, and the nose and jaws are rapidly developing. After 8 weeks, the embryo is now referred to as fetus, and it is about 1 to 1.5 inches long at this point in time, and it is about the size of roseberry at the end of the second month. At the end of the third month, the fetus is fully formed. The external genital organs are developed. Fingernails and the toenails appear. Eyelids are formed. Fetal movement increases. The arms and legs are fully formed. The voice box, which is known as the larynx, begins to form in the trachea. If you are visiting our channel for the first time, do well to subscribe to our channel. It is absolutely free. Comment, like, and share this video. Now that you are in your second trimester, there are a lot of things to look out for. During this period, you might be interested in finding out the size of your baby and feeling your baby moves for the first time. During the second trimester, the fetus will grow to about 7.5 cm and weigh about 30 grams at week 13 to about 23 cm and 820 grams in week 26. For better understanding and to provide a comparison, the fetus will grow from a size of a lime to a banana and eventually to a size of cauliflower. During week 13, the fetus face will look more human-like every day. The hair are now in place. Body will grow more faster. They will be able to put thumbs in their mouth during this period. All essential systems and organs are fully formed. The umbilical cord is fully matured and it is protected by Watson's jelly, a thick substance which makes the umbilical cord to be slippery so that it can move freely around the fetus. At the same time, if you are having a girl fetus, hundreds of thousands of eggs are forming in the ovaries. Females are born with their entire life supply of eggs. The digestive system allows the fetus to taste the food taken by the expectant mothers through their amniotic fluid. The excretory system are working hard with urination taking place about every 40 minutes. A type of fine hair called honeycomb covers the fetus body, which helps to protect them and keeps them warm while they grow. The hair typically falls off prior to birth. At about week 19, the mother may start to feel the fetus move, known as quickening. The fetus moves frequently, including stretching, kicking, and turning. These may feel like bubbles pumping. If the placenta is attached to the anterior part of the uterus, it takes longer for the fetus to kick because anterior placenta is an extra layer of cushioning. By week 20, the fetus can respond to sounds. Additionally, during this period, ultrasound scan can be performed to ensure the fetus organs are developing properly. Their sex can also be determined during this period. During week 23, billions of brain cells that direct functions like breathing and movement will develop. By week 24, significant changes and developments occur in the fetal brain. The brain is growing rapidly, increasing in size and complexity. This period is marked by substantial growth in the cerebral cortex, which is responsible for higher brain functions such as thought, memory, and consciousness. The process of forming new neurons, called neurogenesis, is particularly active during this time. Billions of neurons are being produced and starting to migrate to their designated locations in the brain. The formation of synapses, called synaptogenesis, which is the connections between neurons, accelerates during this period. Synaptic connections are crucial for the brain's communication network and overall functionality. Myelination also begins. The sensory areas of the brain are also becoming more specialized. The fetus start to respond to various stimuli, including sounds from outside the womb. The responsiveness indicates that the sensory pathways are developing and becoming more functional. Detectable brain wave activity begins around this time, showing that the brain is becoming more active and organized. During this period, surfactant is also produced. Type 2 alveolar cells in the fetal lungs start producing surfactant. This initial production is crucial for preparing the lungs for breathing air after birth. This is why, starting from week 24, baby has a chance of survival if they are born prematurely. However, survival rate during this period is about 43%, and about half of them will suffer a long-term complications. Women who may be at risk of giving birth prematurely can be given steroids to prevent their babies from having trouble breathing once they are born. This will be determined by your doctor. The steroids stimulate the maturation of the baby's lung. Having considered the changes that happen to the fetus during the second trimester, it is important to also talk about the changes that happen to the mothers. The first thing we shall be looking at is the physical changes. During this period, a expectant mother gained about 0.454 kg per week, which is roughly about 6 kg throughout the second trimester. There is also abdominal growth. The uterus expands and the belly starts to show more prominently. Breast changes. Breasts also continue to grow and may start to produce colostrum, which is precursor to breast milk. Skin changes. Stretch marks may appear on the abdomen, breast, and thighs. Some women experience darkening of the skin, which is called linea nigra, and changes in pigmentation, called chlorisma. As time goes on, stretch mark might become unnoticeable. There is also increased blood volume. Blood volume increases to support the growing fetus, which can lead to more noticeable veins and sometimes swelling in the legs. Most symptoms that pregnant women do observe during the first trimester begins to decrease during the second trimester. Now let's take them one after the other. 1. Morning sickness. Many women find out that nausea and vomiting subside during the second trimester. Second, increased energy. Energy levels often improve compared to the first trimester. Pains and body aches. Backache and pelvic pain and round ligament pain may occur as the body adjusts to the growing fetus. Also, the pregnant woman may also observe or experience breathlessness. Why? Some women might experience breathlessness as the uterus grows. The uterus can press against the diaphragm, causing shortness of breath. Breast X contractions can also be present or observed during this period. So let's move on. Third changes to the mother during pregnancy is emotional changes. 1. Mood swings. Hormonal changes can continue to affect the emotions. Another one is excitement and anxiety. Many women feel a mix of excitement and anxiety about the upcoming birth and changes in their lives. Finally, the second trimester is often considered the most comfortable period of pregnancy, as many early symptoms subside and the risk of miscarriage decreases. It is a critical time for fetal growth and development, laying the groundwork for the final stages of pregnancy. Last trimester, which is the third trimester of pregnancy. The third trimester begins from week 27 to 40 weeks of pregnancy. The fetus is considered full-term at the end of 37 weeks. The expectant mother gains about 0.5 kg per week till delivery. The trimester brings back some of the toughest early first trimester symptoms, such as fatigue, frequent need to pee, prostate X contraction. The third trimester is a kind of steady growth as the fetus gets ready for birth. Please, if you are visiting our channel for the first time, do well to subscribe, comment under this video, like and share. I hope this video will serve as a helpful companion throughout the journey of pregnancy, and also will also serve as a guide to all healthcare providers. At 27 to 30 weeks, significant changes occur for both the fetus and the mother. The fetus continue to grow rapidly, gaining more fat and muscle. By week 30, the fetus typically weighs around 1.13 to 1.36 kg or 2.5 to 3 pounds and measures 38 to 43 cm or 15 to 17 inches in length. The lungs continue to mature, producing surfactant, a substance that helps the lungs inflate with air after birth. The lungs are the last major organ to finish developing, and they are the only system that stay primarily dormant until birth. Every other system, such as the cardiac system, are fully up and running, even while the fetus is in utero. The fetus gets their oxygen supply through the placenta. The brain grows more complex with increased development of neural connections and grooves on the surface. The fetus senses, such as hearing and sight, become more developed. The fetus can respond to sounds and light. Movement becomes stronger and more coordinated. The fetus may settle into a head-down position in preparation for birth. At 31 to 35 weeks of pregnancy, the fetus continues to grow rapidly, typically weighing around 1.8 to 2.3 kg, that is 4 to 5 pounds, and measuring about 16 to 18 inches, that is 41 to 46 cm, at the end of 35 weeks. The brain undergoes significant development with increased folding and more connections being formed. The nervous system continues to mature. The fetus lungs continue to develop, and at the end of this period, the lungs are nearly fully formed. The fetus immune system. At this stage, the fetus begins to receive antibodies from the mother, helping to build the immune system and prepare for life outside the womb. At this stage, movements may become less frequent but stronger as the fetus has less space to move. The fetus may also start to settle into a head-down position in preparation for birth. At 36 to 40 weeks of pregnancy, the fetus continues to grow and gain weight rapidly. The average weight during this period is around 2.7 to 4.1 kg, that is 6 to 9 pounds, and the length is about 19 to 21 inches, which is 48 to 53 cm. The lungs are fully developed and ready to function outside the womb. The production of surfactant is complete, aiding the baby's ability to breathe after birth. The brain continues to develop rapidly, with significant growth in neural connections. This development will continue after birth. The fetus accumulates more body fat, which helps to regulate body temperature after birth. During this period, most fetuses settle into a head-down position in the pelvis, preparing for birth. This is called cephalic presentation. Fetus movement may become more restricted due to limited space, but remain strong and noticeable. Let's consider maternal changes as well. At 27 to 30 weeks, the mother continues to gain weight, typically around 0.5 kg, which is about 1 pound per week. As the uterus expands, it can press against the diaphragm, causing shortness of breath. Also, irregular, painless contractions, called Braxton-Hicks contractions, may start occurring as the body prepares for labor. Increased blood volume and fluid retention can lead to swelling in the feet, ankles, and hands. Finding a comfortable sleeping position may become challenging due to the growing abdomen and increased fetal movement. During this period also, some women may also experience back pain due to the additional weight and changes in posture. Both the fetus and the mother undergo significant changes during this period, preparing for the eventual birth and postnatal adaptation. Regular prenatal checkups are essential to monitor the health and development of both. At week 31 to 35, as the uterus expands further, it can press more on the diaphragm, causing increased breathlessness. Irregular painless contractions may become more noticeable as the body prepares for labor. Increased fatigue is common as carrying extra weight becomes more physically demanding. The growing uterus can put more pressure on the bladder, causing more frequent trips to the bathroom. Regular checkup is encouraged at this period, which will help to ensure that any potential issues are addressed promptly as the due date approaches. At weeks 36 to 40, the cervix starts to enphase and dilate in preparation for labor. The fetus dropping into the pelvis, known as lightning, can cause increased pelvic pressure and discomfort. Also, pressure on the bladder increases, leading to more frequent trips to the bathroom. During this period, some mothers experience a burst of energy and a strong desire to prepare their home for the baby. Back pain and general discomfort may intensify as the baby's size and position put more strain on the body. Finally, a blood-tinged mucus discharge from the cervix called show or bloody show present just before labor begins. These can occur anywhere from few days to few weeks before labor starts. At this period, regular prenatal checkups continue to be crucial to monitor both the mother's and the fetus health. These checkups help to ensure that any potential issues are addressed promptly as the due date approaches. If you would like to learn about phases of labor and delivery, please watch our next video. Medical tips to maintain a healthy pregnancy throughout the trimesters. At first trimesters, once the pregnancy has been confirmed, commence prenatal vitamins. At this time, start taking prenatal vitamins that include folic acid, iron, calcium to support the baby's development, and these will also prevent neural tube defects. Secondly, at first trimester, ensure you eat healthy. Take adequate diet, which are rich in fruits, vegetables, lean protein, and whole grains. Avoid raw or undercooked foods. or unpasteurized dairy products. Third, stay hydrated always. Being hydrated will help reduce common issues like constipation and fatigue. Avoid alcohol, smoking, and drug use. Also engage in mild to moderate exercise, such as walking or swimming. Always talk with your healthcare provider. Immediately pregnancy has been confirmed, start antenatal immediately. Every antenatal registration is crucial for ensuring a healthy pregnancy and preparing for a safe delivery. At second trimester, continue the regular routine which I earlier stated in first trimester. Ensure you monitor your weight and gain weight at a healthy rate. Regular antenatal visit is also crucial at this period, though depending on your appointment with your healthcare provider. At third trimester, continue observing the first trimester medical tips. Prepare for labor. Monitor your fetal movement. Familiarize yourself with the stages of labor and pain management options. And also, do well to like this video, comment, and share. And if you are here to subscribe to this YouTube channel, kindly do that by hitting the subscribe button and hit the notification bell. Labor is also known as parturition. It is a process which starts with regular, painful uterine contractions that cause progressive dilatation and effacement of the cervix, thus leading to delivery of the fetus and the placenta. A fully term pregnancy starts from 37 to 40 weeks, and in some cases 37 to 42 weeks. In the third trimester, before labor starts, the mucus plug called blood tissue that blocks the cervical opening is discharged into the vagina. Sometimes, losing a mucus plug happens days or weeks before labor starts. Sometimes, the amniotic sac might rupture. Either of these indicate true labor. However, these have to be distinguished from a mild and ineffective contraction called forced labor or Braxton Hicks contractions. Once it starts, true labor progresses in frequency, duration, and intensity. The contractions falls on the thick tissue of the cervix, causing it to efface or get thinner and also dilate. Only about 15 to 20% of women will experience water breaking before going into labor. From the moment true labor begins to delivery, usually takes about 12 to 18 hours for the first time pregnancy, and it takes about 6 to 9 hours for subsequent pregnancies. Labor can be classified into three stages: first stage, second stage, and third stage. Now let me simplify it. First stage is divided into two phases. The first phase is known as early or latent phase, which usually lasts up to 20 hours until the cervix dilates to about 4 to 6 cm. At first, there are irregular contractions which occur every 5 to 30 minutes, lasting about 30 seconds, causing the cervix to dilate from 0 to 3 cm and emphase from about 0% to 30%, which is followed with regular contractions, which happens every 3 to 5 minutes and lasts about 1 minute or more. And this causes the cervix to dilate to about 3 to 6 cm and emphase to about 80%. This marks the beginning of active phase of labor, during which the cervix dilates to about 6 to 10 cm and emphasis to 100%. At this phase, contractions are very intense, lasting about 60 to 90 seconds, each with only 30 seconds to 20 minutes of rest in between. Also, amniotic sac have to be ruptured at this point if it hasn't been ruptured. Once the cervix is fully dilated, we enter into the second stage of labor. At this stage, the fetus head moves down to maternal pelvis, and this depends on the three P's: the pa, the passenger, and the passage. Pa refers to forceful contractions. Passenger refers to the fetus. Passage refers to the route the fetus has to travel through to the bony pelvis. Let's consider few factors that determine how easy the passage is for the fetus. 1. The fetus size. One critical factor is the size of the fetus head. 2. Also, there is fetal altitude, which refers to the way our fetus body is flexed. I'm not talking about personality here. When labor begins, the fetus body is normally fully flexed, which means the chin on the chest, rounded back, and flexed arm and legs. In this position, the smallest diameter, which is referred to as suboccipitopregmatic diameter, present at the pelvic inlet. Larger fetuses and those who are not completely flexed have more difficulty in making it through the passage. 3 is the fetal eye. This describes how the fetus is positioned in the uterus. A longitudinal fetal eye is the ID, where the fetus long axis, that is the spine, is parallel to the mother's long axis. The fetus can also be transverse lie. In this position, the baby's head is on one side of the mother's body, and the feet are on the other side, making it difficult for a vaginal delivery. Or it can be oblique, in which the fetus is positioned diagonally in the uterus, with the head pointing towards one of the mother's hips and the feet towards the opposite side. Both oblique and transverse lie are not ideal and will hinder the progression of labor. 4. Fetal presentation, that is the presenting part. Cephalic is the first part, which means the fetus is presenting with the head first. This is the most common and ideal presentation for easy delivery. Cephalic presentation can either be vertex, which is the most ideal. It indicates flexion of head. Face presentation, which means fetus face is presenting first. Brow presentation, forehead is presenting first. Chin presentation, chin is presenting first. Breech presentation refers to a fetal position where the fetus buttocks or feet are positioned to be born first. It can either be frank, footling, complete breech. Shoulder presentation, shoulder presenting first. To make it through the passage, the fetus makes several positional changes, which is called cardinal movements of labor. There is downward movement of the fetus to the pelvic inlet, called the descent. The degree of descent is called fetal station. This type of fetal descent is measured in terms of the degree to which the presented part of the fetus has descended into the pelvis. This falls into 3 stages. Early descent. The fetus begins to move down into the pelvis, but the presented part is still above the ischial spine. The fetal station is about -3 to -1. Another type of descent that we are having is active descent. The fetus moves down through the pelvis, with the presenting part reaching the level of the ischial spine. It is called engagement at this period. There is also flexion and internal rotation, in which the fetal shoulder internally rotates to about 45 degrees and then descending further. Fetal station is about +1 to +3. Another one is final descent. The presented part reaches the vaginal opening and crowning occurs. After the fetus head passes through the symphysis pubis, there is an extension, in which fetus head will change from flexion to extension and emerge from vagina. Fetal station is about +4 to +5 at this period. After the delivery of the head, There is restitution, with the head externally rotates so the shoulder can pass through the pelvis outlet. Finally, at this stage, there is an expulsion where the anterior shoulder slips at the symphysis pubis, followed by posterior shoulder, and followed by the rest of the body, which ends the second stage of labor. Third stage of labor commences immediately after the baby has been delivered. The uterus contracts and the placenta begins to separate from the uterine wall, and it must be carefully removed to ensure there are no placenta remnants in the uterus. Your healthcare provider will also examine the placenta to ensure it is intact, because any remaining fragments must be removed from the uterus to prevent bleeding. Your vagina will also be examined for any tears, and if there is tears, it will be sutured. Sometimes several hours after delivery is referred to as the fourth stage of labor. There are various physiological changes going on during this period, such as adaptation to blood loss and the start of uterine involution. In summary, the first stage of labor starts with true contraction and ends with the cervix fully emphased and dilated. Second stage is the pushing stage, which ends with the birth of the baby. The third stage ends with the delivery of the placenta. Thank you for joining me on this journey through the incredible process of pregnancy, labor, and birth. It is a story of courage, endurance, and life itself. Remember, knowledge is your greatest ally, and every step you take to prepare brings you closer to the positive experience. If you enjoyed this video, kindly hit this like button, share it with someone who needs it, and subscribe for more empowering content. Let's keep the conversation going. Drop your thoughts or questions in the comments below. Until next time, stay informed, stay empowered, and remember, every moment of labor brings you closer to the greatest gift of all, which is new life.